Good morning. Is everyone set? Very good. We only have one new case of COVID-19 in Queensland. They were in home quarantine linked to the Intrapilli Delta cluster. They're a household contact of 3 existing confirmed cases. That brings that cluster to 145. And for the first time in some time, we don't have any COVID patients in intensive care. From 4 p.m. Today, as you know, restrictions will begin to lift here in the southeast, while we also endeavour to strengthen our border, and those vaccine requirements, mandatory vaccine requirements, will come into effect at 1 a.m. Tomorrow morning. We want to recognise and thank the role that our Western border councils have played in helping us to strengthen those border restrictions. And today I'm announcing that we've allocated $1 million that will be available to those Western border councils to assist them with the cost that they have incurred throughout the border closure. They've been asking for some time for that assistance, and I indicated that the next time we close the border, we would consider financial assistance. And this really just recognises the really important contribution they've made assisting our police. We've also now had confirmed that the ADF will also be assisting our police with the border. So in response to that request for ADF personnel, we've been advised that 120 personnel from the Army, RAF and Navy will be available to our police to bolster their border restriction efforts. They'll be available from the 25th, and we certainly welcome that support from the Commonwealth.
Thank you, Deputy Premier. So yes, one new case in quarantine at home with their family. So this is a young child, the younger sibling of a child that attends Ironside State School. So that student was the first case in the family. Then both parents became infected, and then this child, although they tested negative 4 times, we did serology, which confirms that they had had the disease while they were there in quarantine and had fully recovered. And we know that that does happen with younger children, but that's of no risk because they were in quarantine the entire time when they might have had been active with that infection, and certainly now have fully recovered, so can leave quarantine, leave isolation. Other than that, no new cases, which is excellent news, and it means that we can remove some of those restrictions at 4 o'clock today. But because of what is happening on the other side of our border, very close to us, and I am getting positive sewage test results from New South Wales each morning, which shows that the cases are gradually moving north, it is really important that for another week we maintain some of those restrictions, particularly wearing masks. And please, could everyone wear a mask when you need to, when you can't socially distance, and particularly, of course, indoors where the highest risk is. If you can't wear a mask, for your own safety, you should seriously consider staying at home. It is really, really important. Masks protect people from getting infected, and they protect the people around someone who is infected from spreading. We've seen that time and time again. So masks are critical going forward. I know they're uncomfortable, but I'm saying for the next week, while we work out how we can most safely manage our border, for the next week they are critical that we continue to use them. Then the other critical thing that we all need to do is to get vaccinated. So anyone age 60 or older, please, there is absolutely no difficulty getting the AstraZeneca vaccine. From your GP, if your own GP is one of those very, very, very few who doesn't have the AstraZeneca vaccine, talk to your GP, and your GP will help you find another GP that can vaccinate you. Or you can go to a pharmacy. There are an enormous number of pharmacies throughout the state that can vaccinate with AstraZeneca, or go to one of the Commonwealth vaccine centres. There is no problem. So we're doing pretty well, around 80% of our people in that age category being vaccinated, but there are still some people who haven't been. So that's really important. Given we're not in an outbreak in Queensland at the moment, please wait till 12 weeks before you have your second dose of AstraZeneca, unless your GP thinks otherwise. So for the vast majority of people, given we're not in an outbreak in Queensland at this point in time, wait for 12 weeks to get your second dose of AstraZeneca. Then if you're under 60, you would have seen the announcement yesterday by the Prime Minister that people who are aged 16 through to 59 will shortly be able to go in and book for a Pfizer vaccine. So here in Queensland, I ask you all to register. So then we can manage those bookings, because I don't want a single empty slot in any of our vaccine clinics. I want to be able to pull people in so that we can fill every single slot. And the easiest way to do that is for people to register, and then we can say, come ahead and book, and we can make sure all of those spots are taken up. Then for 12 through to 15-year-olds, if you have any serious underlying disease, work with your paediatrician and make sure that you organise a vaccine. That's really important. It won't be long and we'll be looking at vaccinating all 12 to 15-year-olds, but at the moment it's only First Nations kids who are 12 to 15 and kids with a severe underlying disease. But as I say, it won't be long before all of that age group is able to come forward and get vaccinated. So please wear masks, get vaccinated, and any symptoms whatsoever, doesn't matter what they are, just come forward and get tested so we can find that first case in an outbreak, which means we can get on top of it really quickly. Thank you.
So big shout out to our vaccination clinics. 20,420 vaccinations yesterday. That is our highest daily number. And we're just so thrilled so many people are coming forward and getting vaccinated, and I thank all of the staff. We saw the Care Army out yesterday supporting us at the Logan Entertainment Centre, to everyone who is working hard to make sure that Queenslanders are vaccinated. We say thank you. But I do want more people registering for their vaccine. So if you're not booked in with the GP or not booked in or going to a community pharmacy, please book in with one of the state vaccination centres by getting registered. If you're not registered, you can't get a booking. And our registrations have stayed stable over the last 24 hours. We're just over 190,000 because we're able to pull people out of that registration system and get them into bookings as quickly as people are coming into the system. So we want to see that number much higher. So if you're not registered, you can't get your vaccination through a state clinic. So please get registered. A big shout out to those clinics that are particularly doing a lot of our essential border workers. Broadbeach yesterday had 1,199 bookings, but in fact did 1,915 vaccinations. So they took over almost an extra 800 walk-ins to ensure that those essential border workers are vaccinated. We have clinics right across the border, including those regional towns that are offering vaccination for the communities in those border towns, but also to those essential border workers as well. And we saw yesterday we've got people coming to the Logan Entertainment Centre, to the Brisbane Convention and Exhibition Centre, and also to Ipswich, getting those vaccinations who are those essential border workers. That does come in at 1 a.m. tomorrow morning. We do expect for everyone who is coming into Queensland to have at least one vaccine if they want to work over the border, or if you live on the Queensland side and you're going into New South Wales to work and coming back each day, you are still required to get vaccinated as well. I want to remind everyone, as the Chief Health Officer and the Deputy Premier has, the restrictions change at 4 p.m. this afternoon. People are still required to carry their masks. So you are required to wear it indoors. Whenever you go grocery shopping, you go to retail stores, you must have your mask on. But outdoors, you must have a mask on you at all times in case you can't social distance. The last thing I want to say is we have said this almost daily for the last 18 months. If you have any symptoms whatsoever, no matter how mild, go get tested. I'm hearing a lot from our community pharmacies that people are walking into their pharmacies on a daily basis asking for cold and cough medicine. My message is this: if you are needing cold or cough medicine, you have COVID symptoms. Go get tested. Our pharmacies have been asking people have you got a negative test? And a lot of people are saying, no, I've just got a head cold. You don't know that you've just got a head cold. Before you go to your pharmacy, before you go anywhere else in the community, if you wake up with those sorts of symptoms, sore throat, runny nose, a cough, go straight to your testing clinic and wait for your results. If you do need relief through medicine, see if a friend or family member or someone else can pop down to the pharmacy for you and get that medicine. But it's so important that you don't go anywhere else while you've got those symptoms. You go straight to a testing clinic and you wait for that negative result. You do this and we will all keep each other safe. Thank you.
I'll start with our borders. So yesterday we saw 8,425 vehicles intercepted with the 100% checking that we do. Continuing to see less turned around, so 225 turned around yesterday. And one had to have enforcement action taken against them with an on-the-spot fine for attempting to get through when they couldn't repeatedly. As everyone knows, there's a changed regime coming in as of tomorrow morning, and the message is very clear to everyone that's going to be using those border crossings with New South Wales that we are going to take a very rigid approach with respect to that. What I mean by that is that our officers always have the discretion around whether enforcement action is appropriate or not. But anyone that comes to our borders who does not have the appropriate pass and cannot verify as requested by the police will not get through. So it won't be simply good enough to be near enough. So what I mean by that is make sure you have everything in play before you get to the border, because if it's equivocal, our officers will turn you around. Unless you can clearly demonstrate you're authorised to get across with the appropriate pass, if you're an essential worker, the immunisation record, and in some instances, depending on what the essential work is, support from a Queensland Government Director General, they will not get across. Similarly, if they have an exemption for other things such as medical appointments and that, be prepared to demonstrate that you actually have proof of that occurring. I'm sorry to say we're not going to go away from that posture. It's going to be quite strict, and I know that what happens every time that we have changed border restrictions, it gets quite difficult for a period until people understand it. Let's try and get this right up front. Overall, yesterday, enforcement was still relatively low, so 6 on-the-spot fines, 3 for masks, and we handed out 30 masks across the state. Please make sure you do understand the requirements for masks. We are hearing anecdotally and starting to see some evidence of people claiming to have exemptions for masks that they don't have. We will continue to monitor that, obviously. Please work with police. We will always give you the opportunity to wear a mask. Our officers carry masks, and if they ask you to wear one, please do so. Thank you.
Yeah, they're under 10. Under 10. Right, there's a very clear list on our website about who are essential workers and who aren't. Having said that, I've asked all the Director Generals of all the departments to ensure that they are genuinely, absolutely, critically essential, because the more people we have crossing the border, the bigger the chance that one of them, it only takes one, will have COVID. So the groups are very clear. So there are healthcare workers, so doctors and other registered healthcare workers who are registered with APRA, except not chiropractors, but if you have a look on our website, there's all of those that are listed, so you can imagine physios, OTs, so forth. Then there are farm workers and farmers, agricultural workers, and the DG of DAF manages those. Then you've got construction workers that are essential for critical infrastructure, that they cannot delay that work and that they cannot find people in Queensland, because one of the requirements is it needs to be someone where they can't find that skill set in Queensland, that the work can't wait and that it has to be done by that person. And then we've put in that additional mitigating factor, they need to have had at least 1 dose of vaccine. So the aim here is to just slow the movement across the border. It's very tight, yeah, because as we've all seen time and time again, with Delta, you only need one case and you can end up with major spread. It's totally different to last year. We were getting very confident at managing those other variants. We've had outbreaks due to Alpha and we've managed them, and we were quite confident we could, but with Delta, it's really difficult. Yep. Of course, that's the plan. So by these workers getting dose 1 this week, they'll be able to get dose 2 in 3 weeks' time, because I'm sure most of them will be having Pfizer, and then 2 weeks after that, they'll have full protection. So that's about 5 weeks' time. And during those 5 weeks, I hope here in Queensland, we'll have a significant proportion of our population protected. So you need to have both sides. You need to have the person who's going into the area where there are cases protected from getting it, and we know that vaccination isn't a total protection, but it certainly decreases the risk. Then you need where that person is going to for the people there to be protected. So it really depends where we are with our vaccine numbers here in Queensland in 5 weeks' time. No, that will be decided by New South Wales. Remember, New South Wales has required anyone who lives within New South Wales to stay at home except for those essential reasons. So children, unless they're the children of an essential worker, can't go to school. That's a New South Wales directive. So that won't change till New South Wales changes. Well, I understand that we hope to get the Pfizer from the Polish shipment next Tuesday. So we got that confirmation yesterday. It's still being confirmed by TGA. So that's when we hope to start seeing that ramp up. Yeah, yeah. Sorry, I can't hear you. I'm so dependent on seeing, I'm not deaf, but I like seeing people's mouths. Yeah. Well, at the moment, it's only essential workers. And the reason being that we can see the data from New South Wales, they're seeing 2 types of infection. They're seeing one where people are, not following the rules, they're still going and visiting our other households for whatever reason. Then the second group is the essential workers group, because they have to go to work. So they're going to work, getting infected at work, and bringing the infection back into their home. And that's what I'm trying to prevent happening here. So that's why I'm asking essential workers to get vaccinated. We are also making our vaccine clinics available, so people who live in that northern New South Wales area, if their closest vaccine clinic is here in Queensland, that is a reason that they can cross the border. If they've got an appointment, they can come and get vaccinated. But at this point in time, there's not a requirement that they must be vaccinated. Yeah. Yeah, because for some areas, particularly going out further west, we provide all of their healthcare services, including vaccination. They don't have an option to go anywhere else to get vaccinated, so they can still cross the border to get vaccinated. Of course, that's not as essential in Tweed because they've got their own vaccine clinics there. Well, they're not allowed to do that because that will be people will know, and they're not doing that. I mean, that's why we've managed so well in Queensland, that people have genuinely followed the rules. So, no, they will come across and get a vaccine, and I want them to come across and get a vaccine, because the more people who are vaccinated along that border zone, the better protection for Queensland. If they're an essential worker, and that is the reason they're crossing the border, and that would be the only reason if they live in New South Wales, then as of 1 a.m. tomorrow morning, if they haven't had one dose of vaccine, they will not be allowed into Queensland. It's crystal clear. I haven't seen that. If they're under the freight protocol as per National Cabinet, yes, every 7 days they need a negative swab. But that's under the freight protocol, which is a national protocol that's been implemented by every state and territory. Other people, there isn't that requirement. I don't think likely is the right word. It's possible, but I think people should just get themselves vaccinated. I think that's critical. The reason I'm asking critical workers and essential workers to get vaccinated is because they're going into workplaces. And we know if they're going into a workplace in New South Wales, that's a risk. They could acquire the infection there. And if they're coming into Queensland, into a workplace, they could bring the infection into that workplace. That's why I need them to be vaccinated. They need to get the first dose, and I'll be very, very clear. Once we've had 3 weeks, I'll then be asking, could Queensland please mandate the second dose?
Dr. Young, those workers that are coming across the border, have you had any data on how many are vaccinated so far and what that's showing?
We have had some data, but I don't have it with me. Yep, so the Premier has already stood up and said these new restrictions will be in place for 1 week.
Oh, I'm not sure about the comparison, but certainly throughout the entire pandemic, Queenslanders have surprised and impressed us with how willing they are to support each other, to keep each other safe, and that's been a crucial part of the success so far.
Is it unlikely we're going to have lockdowns where we reach 70 to 80% vaccination rate? And why can't you adopt it yesterday? What doesn't go?
Oh, well, the modelling says that it's less likely at 70% and much less likely at 80%. The modelling is based on a number of assumptions. It was done at a time when transmission in the community was very, very low. That's not the case now, and we can't predict the future, Jack. There's lots of different hypothetical scenarios, and they're very, very difficult to predict. But we support the decision of National Cabinet, which says that if 70% of the community are vaccinated and there's very low rates of transmission, then lockdowns will be much, much less likely.
In Israel, they've got 78% of all people over 12 fully vaccinated. Their 7-day case average is 6,500 and 7-day death average is 19. That's what 80% vaccination looks like as a government compared to something like that. Would you start implementing lockdowns again?
We'll prepare for all possible scenarios, but we support the decision of National Cabinet, which is that at those thresholds, 70 and 80%, lockdowns become much less likely and can be much more targeted. Oh, look, it's disappointing, but I understand. Ultimately, people who live in New South Wales are citizens of New South Wales, and so we asked for that accommodation because it would make our job a lot easier and make the lives of people who live in those regions much easier. But I also understand New South Wales not wanting to do that. They've made that decision. It's disappointing, but I guess understandable. Oh, look, I understand they've said no. If they came back to us and said they'd reconsidered, well, that would be great. Of course, once there is transmission in that area, then the opportunity to do that passes. So there's only a window of time in which we could consider moving where the border is implemented. The 25th. Look, I expect all of our healthcare providers and aged care providers will comply with the law. They do with all of our other laws and accreditation requirements, and I expect they would here. The circumstance that you're describing there is anticipated to be very, very rare. It's only those circumstances where it would be unfair, if you like, would cause unnecessary suffering to transfer the patient to a provider where those services can be provided. Look, the Law Reform Commission considered whether there should be penalties and determined that there didn't need to be. There are, of course, accreditation arrangements, but our healthcare providers and our aged care providers, they comply with a lot. There's a lot of laws, a lot of legal requirements on them, and they comply with them. Look, I want to see what the committee has considered in their deliberations. I understand their report will be available imminently, and I'll have a look at it once it is.
A couple of questions about, first of all, with the vaccinations, people on the waiting list, how are they getting decided or triaged, if you will?
Sure.
Because
So,
there's a lot of people who only just registered and who are younger than getting pushed up a queue ahead of people who are older and have registered.
So with the registration system, when people check in, there's a number of boxes that they can identify themselves as, particularly around their occupation. We want people to fill that out, so not just say, I'm a female between this age. I want to say I'm a teacher or an aged care worker or a health worker or a police officer, so we can give them priority. Once we've worked through the priority groups for the booking system, if bookings become available at short notice, then they start working their way through the system. Of course, we want people who have been waiting in the system for a while. We've cleared a lot of those people. In fact, when the convention centre opened last week, some of the people I spoke to, even though they said, I only booked in yesterday, they actually said they registered back in February. So there's a difference between only booking in at short notice and actually being in the registration system for a while. But we are clearing those people quite quickly. And when the bookings become available, if there's cancellations or whatever, people might get quite short notice. So we may invite a whole lot of people. We might send 100 invitations out for booking, but 10 people come back saying, yes, I can do tomorrow. So there are plenty of ways that we're inviting people in. I do want to say very quickly, because we didn't say this morning, and this is such good news. We had one person still in ICU in Queensland. That person has now been moved to a ward, and I just want to say what great news that is, and thanks to our health workers looking after that person. So it's due to the Director General today. I will then get briefed and be briefing Cabinet. We expect to release it very quickly. We have said we will release this. It's really important that we have transparency and we learn from whenever we do have transmission in our hospitals. Only this morning I read that New South Wales is having a transmission in one of their hospitals every single day in the last 2 weeks. Every day there's a transmission happening. So we do need to look at the lessons learned and what we can do to reduce the risk as much as we possibly can as far as transmission in our hospitals. We're hoping within the next week or so.
Also, today is 100 days since the $100 million was announced. Do you think we are still seeing a lot of congestion, even Wednesday night, a lot of congestion at all hospitals?
Yeah.
Do you think the $100 million is enough? Or I mean, look at other states, they've put in significant...
Well, $100 million's what we announced earlier in the year. I also announced only about 3 weeks ago additional funding as well, which is opening up a lot more beds in the short to medium term. So the $100 million was just the start. We've announced more money since then and more beds coming online. We've also got to remember we've had 2 lockdowns since we announced that funding and that initiative. And what lockdowns do is suspend everything. So as far as we've done such an incredible job clearing backlogs of elective surgery from last year when there was a National Cabinet decision to suspend surgeries. And just as we catch up, it goes on hold again, and then we have to play catch up. And every time we fast track elective surgeries, that takes up beds. And we've seen some, very serious big accidents lately as well, and emergencies. That takes up beds as well, and that puts pressure on our emergency department. So it's not a simple answer. It's not just about EDs. It's about bed capacity, and it's about changing practices I'm seeing some really good results. For example, Metro North are seeing some really good clearance rates now, but we want to get them much lower, and we will continue to work across our entire health system to bring those numbers down and get patients off stretchers as quickly as we possibly can. Sorry.
Look, I am aware that the Water Department is constantly working to model out how population growth will impact on water supplies and what strategies we can put in place to address it. I haven't seen that particular report, but no doubt they're aware of it and are looking at it.
The water levels have been below, levels have been below 60% since September, because they're bringing for SEQ water to consider revitalising this recycled water system. What, if they're not going to implement that, what else will we have to do other than raising money?
Look, as I say, the Water Department has lots of work underway to develop strategies that can ensure that we have sufficient water to address what is a booming population growth here in the southeast. No, the range of reforms that we put in place will take some time to work their way through the system and some time to have an impact, but they were based on the best possible advice. They were what the police said to us would assist them to address these concerning crime events, and we need to give them some time to do their work. Oh, look, there's a range of considerations that police and the courts need to take into account, and so there's only certain circumstances where they are appropriate. But I think it's good and useful that they're available now as a tool.
Police have put on 2 extra special prosecutors, I see, to prosecute serious repeat offenders. Do you think that'll make a difference in trying to keep these repeat offenders behind bars?
Well, look, throughout we've taken the advice of our police, and if they think that will assist them, then I think that's a good thing, and they wouldn't be suggesting that if they didn't think it would work.
Yeah, it's a very important question, and that's what the Doherty has been looking at and modelling. So we'll just work through all that modelling information. Yeah, you can go onto their website and you can see it all. But from memory, there was Port Macquarie, Byron Bay, a lot further west, Wilcannia, so quite a few areas. Oh no, they're very, very quick. New South Wales has got a fantastic process, and I've been very reliant on that. Yeah.
From a worker to employer in South Bank who a bunch of the staff members got a call from the Yvette Centre vaccination site saying they had some doses available to
Yep.
start. They weren't allowed to go down to get that vaccination by their employer. Is that concerning that?
Maybe you should ask the employer about it, because I don't know. An employer's got so many things they've got to juggle. I don't know what the other requirements were and whether the employer then organised another time. Why didn't you speak to the employer? It's a very important issue.
Deputy Commissioner, we asked you about those special prosecutors. Can you tell us why have police felt the need to bring those special prosecutors in?
Tim, I'm happy for you to ask. Unfortunately, I'm a bit busy with COVID at the moment, so I really think you should go back to our organisation and get a proper brief on that. I'd be guessing. Sorry, mate. Sure. Yeah, not full details yet. I'm aware there has been a drug seizure. Can I tell you that's happened periodically through our whole operation, that people continue to try and commit criminal activity, and probably not the wisest thing to do when you've got a checkpoint with police personnel. I'll let the community draw their own conclusion around that. It clearly wasn't successful. Can I also just finalise by saying it's wonderful news about the ADF coming on board. That will be operationalised as from the 25th They actually gave us 120, which is 20 more than we asked for. We are very grateful. They've been a wonderful partner all the way through. Thank you.
Thank you.